Are you guilty of ignoring that knee pain and knee swelling until it is so bad that you can barely walk, and in fact, it's stopping you from sleeping every night? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you why it is important that you address that knee pain and knee swelling as soon as possible rather than wait and see. So here at My Favourite Physio, we see lots of patients who come in with knee pain and often knee swelling after an acute trauma. Unfortunately, every now and then we see someone who comes in and said, well, actually, I hurt my knee about 3 to 6 months ago, but I did nothing until now because right now I cannot walk, and in fact, it's keeping me up at night. I can barely tolerate anything touching my knee, and it is extremely swollen, and they cannot bend or straighten their knee properly. So I thought I'd jump in and share with you 3 reasons why it is important to actually address your knee swelling and knee pain as soon as possible. So I've got a knee model here, and you'll see that these pink bits are all showing ligaments within the knee joint. So inside your knee joint, you have these ligaments, if you have a look from the front in there and from the back there. So those are your anterior cruciate ligament and your posterior cruciate ligaments. They're very important ligaments because they actually keep your knee stable. On the outside and on the inside of your knee, you'll see these ligaments as well, and they keep that knee joint stable from side to side. If you have swelling in your knee joint that stops you from bending your knee or feeling like your knee gives in, it is quite likely you would have damaged some of these ligaments, and it is really important to get them looked at, because if not, you leave them for too long, you might find your knee is unstable, and next thing you know, you slide off or slip off a bit of wet water, and you would have torn all the major ligaments within your knee. Number 2, when you don't address any injury or soft tissue damage early, what will happen is your body will try to heal itself. What you might end up with is a lot of scar tissue from swelling that is sitting around in your knee joint, and over time it becomes hard, and so you'll find you start to lose range in your knee because there's scar tissue sitting around inside your knee joint and around outside your knee joint. And you could be also damaging all those muscles and tendons on the outside, and that's going to then limit your knee function and stop you from actually getting back to your sports or activity that you truly enjoy. Or very commonly, people will lose the power in their muscles around their knee to be able to run or sprint quickly ever again. And it's a long-term issue that happens if you ignore the acute injury to begin with. Number 3, when you've got a sore knee and it's swollen and you can't bend it and you can't walk properly, what you'll find is you then start limping and you'll affect your opposite hip. So your good leg now starts to suffer, and you get all sorts of secondary problems like back pain and knee pain or hip pain on the other leg, and so after a while, you're finding that you not only need to deal with your knee injury, you're now having to deal with hip and back pain as well. So, if you're out there and you've hurt your knee and you're getting recurrent swelling and pain in your knee, it really is a sign that there's probably a lot more damage going on as you continue to pot about. So it's really important to stop, take time to go see your family doctor, get an investigation on your knee, like an MRI scan. It is important to stop and make time to go see an expert physiotherapist, because physiotherapy can help you overcome your knee pain and knee swelling really quickly. If you're out there and you would love to speak to one of our expert physiotherapists to find out if we can help you overcome your recurrent knee swelling and knee pain, the number to ring here at My Favourite Physio is 02-9790-4233. And if you know somebody in your world who's been putting up with knee pain and is hobbling around every few weeks, barely able to sleep at night, why don't you like and share this video with them? Until next time, have a fantastic day. Bye.